All right. Good morning once again, everybody, and thank you for dialing into our well-informed wellness presentation of taking charge of your healthcare. All lines will be muted for the remainder of the presentation, and we will have a question and answer portion of the presentation at the end where we encourage you to type your questions in for the presenter. With the welcoming of the new year, it is common practice to focus on what changes in our personal health we want to make: eating, better sleep, exercising more. Something that we don't often consider, however, on that journey is our healthcare. The new year is a good opportunity to take stock of what our healthcare benefits look like and how to maximize how we use them. Are you happy with your primary care doctor? Are you taking advantage of all your healthcare benefits? Knowing what you have access to can inform how you take care of your health more efficiently. To help get a better understanding of how to better take charge of your health and your healthcare, we are joined by Karen King. Karen has been affiliated with the EAP as a provider and trainer for over 15 years. She has worked clinically in a broad range of specialty settings, including behavioral health. In addition to her strong commitment to general physical health and well being, she has also provided grief and loss, critical incident, and change management services for over 25 years. She has spoken for a variety of workplace groups, national and international professional conferences, and radio programs. Thank you so much for being with us here today, Karen, and I will now turn it over to you.
All right, thank you so much. My pleasure to be here. Welcome, everyone. Thanks for taking time out of your day to join us. I hope that the information that I'll be delivering to you today will be helpful and really addresses the points that were just outlined for you. There are a lot of things that are positive about the many changes that have taken place in healthcare over the last couple of years. Certainly, the advancement of technology has had a big impact. It's changed basically the whole medical landscape, and there's so much sophisticated technology in terms of even how we diagnose and we treat medical conditions. Um, and that's been great and also convenient in many respects because we'll talk about how we can have virtual appointments and that kind of thing now. But it's not all positive, you know. Um, it makes it in some respects more accessible, but it also in some respects makes it more challenging, and so knowing what's best for you, for your health, how to access it, how to manage it really can be a challenge. And certainly, having reliable health information and access to it is really so important. So, while we're together today, I'm going to be going over some tips on how you can, as the title tells us, take charge of your health care and take advantage of the advancements in helping to make more well-informed and sound decisions as you manage your own health care and those of your family, loved ones as well, because we often find ourselves in a position of having to do that. Okay. Oh, now I'm trying to advance, and I tested it before, as you saw, and my slides are not advancing. Can we have a look? There we go. There we go. Okay. We always have goals, and you see them outlined here on the slide, to gain a little bit of a better understanding of the trend of consumerism. That's a new buzzword, and we are all health consumers. So, how do we do that well? And what to look for when choosing a doctor for whatever reason. You may be looking for a new doctor, strategies on stretching our dollars, which certainly we'd like to do, and a little bit about preventive care, the things we do talk about, all the time, as we're mentioned. Our diet, our sleep, our exercise, all of those things are important. And I'll also put up the information about your EAP as we get to the end of the program, too. All right, so this idea of health consumerism, and you see it, down on the bottom, what's the goal? Well, the goal is for us to take more ownership of our health and our choices that we make regarding it. And isn't that, that's great. We all like to have control. But as I said, there are positives and negatives. What it has really done is shifted the burden of responsibility further in our direction. I know that a lot of health centers, even primary care offices, they don't have the same administrative kind of help. Where we go, there's, you check in with somebody, but there's no receptionist at each of the departments or offices. And so, the doctor walks you to the printer and gives you the printout, and there's more information online. Um, and then it's in your hands. It's not like there's somebody there who's helping you to make copies or to make appointments that have been recommended. So there's a lot more burden of responsibility on us. So, like I said, pluses and minuses. And this idea of consumerism, it's a growing trend. And the implication is that we should be well informed and informed not just about our conditions, but about the cost and the quality of healthcare before we're making choices on where and how we're going to receive it. And, it used to be like you'd go to your doctor. We used to call it the family doctor. Now, we could call it the PCP. They get you a referral for wherever else you need to go, or you go to urgent care, the emergency room, thinking about that. But with consumerism, it makes us more aware of our benefits, or hopefully makes us seek out more information about our benefits and how much various healthcare decisions are going to be costing us. And that's true, whether it's a simple blood test that you're getting at the doctor's office or something more complicated, a procedure, a surgical procedure, we really are entitled to know upfront how much this is going to cost and what to expect in terms of outcomes, the quality, and that increased transparency. It does give us the opportunity to make choices that provide the most benefit for us and our families. But again, in our court, time, I know, and people are, most of us are time pressed. And if you have health situations going on in your family or with yourself, that's another thing that you're adding on top of it. Um, so, it allows us to make some choices that help to drive innovation. We become more aware of what's available. There should be more transparency, more flexibility, and those are pluses. Um, Other things that have happened, are like a lot of digital healthcare has really expanded. And consumers, have demanded that, and it is now available. And if you think back, particularly during the COVID pandemic, a lot of that was going on because we weren't seeing people. So that really pushed more of the digital and virtual kinds of care that's now available. Um, and depending again on your health plan, you have access to see what you're spending and more choices. Ultimately, the goal is really for you to take ownership, as you see there on the bottom of the slide. All right. And that makes us basically active participants in our choices. And, not only do we want to find out if a certain treatment is covered by our insurance, but we also want to learn about the cost. And does the cost vary depending on where we're going? Is it absolutely necessary? One likes to think that if it's being suggested or ordered for you, referred for you, that it is necessary. But there are doctors who are doing research, and it might not be actually necessary for your care, but what they're doing is helping them to gather information. It also, gives us the opportunity to know where's the best facility to receive treatments. I'll talk a little bit about that later. Freestanding Diagnostic centers tend to be considerably less expensive than going to the hospital. That's, and that could be for a mammogram, an MRI, anything that you're actually doing at the hospital site is generally going to cost more than if you go to a freestanding center. And a lot of people don't know that. What does it require? Well, now you have to do a little research about what's available. I just helped a friend do that the other day. She's out of state, and the mammogram place that she's gone to for years closed. So, where does she go now? And she asked the doctor, and the doctor recommended the hospital. But again, knowing that it has a much lower cost if you find a freestanding place, I helped her to do a little research to do that. And we all have the opportunity to do that. And of course, the internet helps us to look up all of those things pretty easily. All right, so if consumerism is the new trend, what does it mean to be a smart consumer? All right. If I paint a picture for you of what a smart healthcare consumer looks like, what do they pay attention to when they're making care decisions? And you see the outline here on the slide. Choosing your doctor really isn't as simple as picking an office that's close to where you live. Some people like to be close to the office so that they can go and then go to work. But location's not the only thing that's important. There are a lot of things to consider. Certainly your insurance, seeing somebody in network. What's the doctor's affiliation with labs and hospital connections? I have known doctors that I really respect who are not, their affiliations are not with really the best health institutions. I lived in Massachusetts for a long time, and Massachusetts is known for having great health care. Certainly Mass General and Beth Israel and all of the hospitals that they have. And there are great doctors right on the periphery of the city, but they're often affiliated with a community hospital. And is that, what you want? Or for me, that wasn't what I was looking for. So knowing the affiliations is really important as well. And then, more on the soft side, what is the customer service? This is a service that we are purchasing. And how is the desk staff? Is this a place where when you call, it's push one, push two, push three for various things, or does somebody actually answer the phone? If you leave a message, do you get called back in a timely manner? Those things matter too. And like there are a lot of variables in terms of what you're going to be paying if in fact you have something going on. Because as I said, a procedure can vary widely in cost based on where it's performed, so you want to be a little bit proactive about investigating those kinds of things. And that allows you to make decisions that are going to work best for you both financially and logistically. Is it convenient for you to go there? Are their hours convenient? Is it geographically convenient? And so you're going to have the best possible experience along with high quality of care. And then if you're actively seeking care when issues are small, that can help to kind of stave off the bigger health issues down the road. And so we're going to talk a little bit about health maintenance as well. And just taking care of yourself and doing the things that matter, going for your routine tests, that kind of thing, is going to save you money and it's going to improve your health outcomes in the long term. The preventive care, the fourth thing you see there on the slide, that's really about going for your annual wellness visit. You don't hear a lot of places saying annual physical anymore. They call it an annual wellness visit. It's similar, but it's not exactly the same. Um, it's where they're going to do, routine things. Maybe you'll have annual blood work, your blood pressure, those kinds of things, but also talking about having and maintaining a healthy lifestyle being important also, making choices that are going to benefit your health, healthy eating, exercise. I like to say activity. A lot of people, they cringe at the word exercise, but really it's only all about moving. And those things do help to prevent issues that later can become costly, difficult to manage, and put your life at risk. So those annual wellness visits do really matter, and it'll be like screening for high blood pressure, diabetes, those kinds of things. When you go, and I'm going to be talking more about this, you want to be prepared for your visit because we don't get a lot of time. There are studies that say that when you go to the doctor, that the average time is 8 minutes. Think about that. My experience is more that like 20 minutes, and I can tell you even 20 minutes is not a lot of time if you have anything going on. And oftentimes, and I had this experience myself recently where I made an appointment and I had a couple of things going on, three, and I sent a note to the doctor ahead of time because I do have digital charts that I can go into. And I sent him a note saying what I was coming for. And when I got there, he had read the note and said, "This is a lot to cover. What's the most important thing?" I said, "They're all important." You know, this idea that you come for one thing, it's just unrealistic. You're not going to come back for another appointment for the second thing. And maybe it's all going on simultaneously. So it takes a little bit of assertiveness as well to get the most out of your health care. So we're going to be talking more about that as well. And you do have a handout that's titled Healthcare Glossary. And that's going to give you some vocabulary and also a glossary of terms relating to insurance, which I won't be talking about so much with the time that we have today. But that alphabet soup that sometimes we get, like you get something in the mail and it's EOB. This is not a bill. Well, what is EOB? And it's an explanation of benefits. And that tells you what it costs, what insurance paid. Is there a copayment for you? What's outstanding? It's not a bill. It's just informational. But a lot of people get those in the mail and they freak out because of the amount that they see on the bottom when maybe they have nothing that they have to pay at all. All right, so choices. We have lots of choices. So we'll start off by discussing some of those that we face when we're dealing with our health care. Tips for how to be engaged, how to be more involved with your treatment, your choices, where you go, what you get when you go there. So the first thing that we'll talk about, you see here, is choosing a doctor. And there are questions to be considered. All right. And I'm just going to pop them all up here. Couple more. Nope. Back one. All right. So where do you start looking? I said earlier about, near the office, near home. Geography isn't the only thing, right? If you need to get a new physician, all right, say you're dissatisfied with the current doctor, or you relocate to a new area, your insurance plan changes, or your doctor retires. There are all kinds of reasons why we are looking for a new doctor. All right. In any of those situations, we are kind of starting from scratch. Oftentimes, like if a doctor is retiring, they'll often give you a reference on who they would recommend that you go to. Maybe somebody's taking over the practice, going to be in the same place geographically. But, what are we doing when we start looking? All right. And most of the time what people will do is they'll get a recommendation from friends and family, and that's not a bad way to go, because if people have personal experience, they are going to be well versed in, does this person meet your needs or not? Do you go to your health plan's website? Most insurance carriers will list all of the doctors that are covered by their plan, who's in the network near you. um, or like I said, getting a referral from your previous primary care. And then you want to think about, what are you looking for in a doctor? It could include a lot of different things as well, and do you want somebody who's a good listener? All right. And, it helps to understand what your priorities are when you're going through this process. Yes, is the office convenient? Yeah, that's a factor. I said, do you prefer to see a male or a female? Do you prefer to see somebody, on the more mature side with a lot of experience, or do you like to see somebody who is younger? Are you looking for somebody who is like more like a peer, a person who is, in your age range because you feel like they're going to understand you better? And those things matter because you have to be comfortable. And you want to also consider a practice. What do they do? Is it a family practice? Can they see everyone in your family? Or is it, a primary care, a geriatric, if you're getting to that age? So thinking about that, sometimes people will actually use their GYN, women will use their GYN as their primary care. You know, Quality, well, how do we know what the quality of the service is? How courteous is the office, like I said, or, how quickly do they return calls? Are there any complaints about them online? Because that stuff is accessible today. And then when you see them, what's their bedside manner? Do they listen? Are they respectful? Do they speak down to you like like you don't understand anything? Explaining things clearly is one thing, but being condescending is something else. So all of those things, are going to come into play, and certainly cost is a factor as well. Are they in network? Do they refer to specialists who are in network? Do they tend to recommend expensive treatments or prescribe brand name drugs as opposed to generics, which tend to be a little less expensive? Do they order a lot of lab work? I had Lyme disease many years ago, and I did find a great doctor, but oh my goodness, he ordered so much lab work. I actually once, this is no exaggeration because I kept track, I once had 36 tubes of blood drawn. That's as much or more than a blood donation. And, because I work in the industry, I said to him, don't the insurance companies go nuts when you do this? And he said no. And he said the reason was because his patients tend to not have heart attacks, not have strokes, not have these other things, because he screens for them ahead of time. You're getting stuck anyway, so. And he participated in research studies. You know, I didn't mind that, but somebody else might really mind that. So just knowing some of those things. Um, and then there's another handout that'll elaborate on some of the things that I'm saying, and that's titled Selecting a Healthcare Professional. All right. And so you want to consider those criteria when you are, in fact, looking for a doctor. We already said, asking for recommendations, check with your insurance company, all of those things, you see right here on the slide. You can check if your chosen doctor is certified by the American Board of Medical Specialties, and that's online. You see it right there. That's the website. Generally, that will be the case. They will be certified. But if they're not, you might want to think twice, all right? There can be a lot of information still to consider. So we said recommendations, yes. Your insurance company, are they covered? Do, do you have a primary care physician? And there are advantages to having a PCP, as we call it, because that gives you, it's like a foundation. All right. Your primary care physician is kind of a first point of contact for your healthcare questions. They are the ones who tend to provide your preventive care. They give you treatments for common conditions. You have a cold, you have a cough, that kind of thing. You're feeling very fatigued. You start with your PCP. They then are basically assessing for, do you need a higher level of care? You know, is this an urgent medical issue? And they'll make referrals to specialists if that's appropriate. And they'll do it with people that they have relationships with. So hopefully then the information is being shared. All right. And I said before, you know, PCPs are there are different kinds of PCPs. As I said, for women, sometimes they'll use their gynecologist. You might go to a nurse practitioner, a physician's assistant. Are you looking for a family practice? So one place will treat everybody in your household. Those kinds of things, all right? And then researching the office. That, again, I said you can go online, see if there are complaints against them, see whether or not they're accepting new patients, because that's important too. You hear about a great doctor, but they've got closed the practice to new patients. So then you're back looking again, or they might be able, their office might be able to refer you and give you some ideas on who else. Again, where's the lab work, the hospital affiliations, the certification, all of that is going to really be important. All right, what else do we want to look at with this? It's this not forwarding. There we go. Digital healthcare. Digital healthcare became much more popular during and after COVID, because, you know, we were all kind of just down at home, you know, we were all staying away from people in general. And the last thing you want to do is go to a doctor's office and be exposed to a lot of other germs that you wouldn't otherwise. And so this whole idea of not having to go in came into place rather. And uh, the technological advancements also, you know, have made a big difference again with the whole idea of diagnostics and treatment. So digital health, broad term, you know, it encompasses a lot of different things. Mobile health for one, you'll see M Health, that's mobile health. There are vans and trucks that go around and you can get tests on them. Um, Electronic health records, my whole chart is online, so I'm able to access that. I have a sister in Connecticut, and she is not well and currently in a nursing home. She also has leukemia. I am able to go into her chart. She gave me her passwords. I have access. So again, I'm long distance, but I can still gather information, you know, which is really helpful if you have an electronic record. There are the wearable devices, you know, even watches today do different things. They'll give you your heart rate depending on how sophisticated it is, and may tell you if you're having some kind of cardiac episode. You can also have if you're thinking that you're being tested for sleep apnea, you can do that at home. You can wear a Holter monitor for cardiac diagnosis, things that you can do without having to go and spend the night in a facility. So those wearable devices have come a long way. Telemedicine, you can have a telephone appointment, you can have a video appointment. And, you know, all of those things are advantages to us as consumers. You know, certainly, again, you see them outlined here, easy to access these kinds of things. Um, Services like urgent care, you know, cold, flu, insect bites, pink eye, things that are common that you can talk about online, or you just go into the urgent care center and have them taken care of. Again, ideally, primary care, make an appointment with primary care, either virtually or telephonically, so that they're in the loop. All right. And they can tell you about what screenings they think you might have. Mental services as well, you know, talk therapy, psychiatry, those things are available virtually. And, you know, anything that you're doing virtually is saving you the time and inconvenience of commuting to wherever it is you need to go, maybe having to wait in the office. It's much more immediate, you know, and you're at home. you're getting stuff done while you're waiting. So those kinds of things really can make a difference as well. Um, and that gives us some flexibility too. It gives us flexibility in how we're getting our treatment. Minor medical ailments easily dealt with through telehealth, telemedicine, virtual appointments, even dermatology. Often, if you send photos and then have a telephone appointment, and it lowers your cost. For us, a virtual appointment is that is doesn't have a copay, as opposed to going to the office where there is a copay. So you can save money as well. And a lot of these services are available 24/7. And there are services specifically designed with board certified doctors that you can get to via your smartphone or devices at any time. Um, and it also, it centralizes your health care as well, with technology being what it is, because our electronic health records have everything in them, and it's easy to access them on your phone or computer to look. I always look ahead at the lab results. Often I get the lab results before my doctor gets them because they go right into my medical record. And so you have easy access. And you have the information if you want to have an appointment on the phone or virtually. You've got that information right in front of you. So it's very efficient. It's less stressful in many cases, and it's also less expensive. And then monitoring your health. I already mentioned the wearable devices, whether that's your smartwatch or the things that they send you home with to do testing. There's a great deal of capability to monitor different things: your oxygen level, your heart rate, cardiac activity. Important, and people are much more likely to do it and participate in it than going to the doctor, getting the equipment or whatever it might be, or going, taking a half day and having the tests done while you're there. Now, I'm saying all of that, but different things are good for different people. What all of this does is give us choices. All right. And, and so you want to check with your health plan to see what are the options that are available to you. The fact that it's easy, more cost effective, less stressful, all of those things are great. But if you're the kind of person who really likes to see someone, well, you know what? You're still entitled to do that. Basically, what we're talking about here is choices, and consumerism is about us having those choices. Is that good? Very good. Does it shift the burden of responsibility to some degree? Absolutely, because there are practices, medical practices that have the expectation that people are going to be doing that, and not everybody does. All right. So when you go to your appointment, and I think that this is, really important, and a lot of people don't think about it. You're focused on getting there and having the appointment. And there's a handout that's going to reiterate some of the things that I'm saying and expand a little bit. And that's called Making the Most of Your Appointment. And you know your office visits, or even with virtual visits with your doctor, they are, as I said, short. And you really want to make the most of the time that you have. So the strategies for that are outlined here for us on the slide. Preparing ahead of time. Write down your questions. That is so important and so helpful. And I will tell you, personally, we've had a lot of experience with that. My husband was diagnosed with cancer this year, and so now we have oncology as well as our primary care. And when we went to our last appointment with the oncologist, between us, we had at least 15 questions, and they were answered and they were answered to the level of our understanding and clarified with other questions That's what you're looking for. You want somebody who is really going to help you. But if you don't write them down, they don't always come to you while you're there. And it makes it more efficient, and the doctor is much more likely to answer them patiently than if you're like there trying to think, there was something else, but he can't come up with it at the moment. If it's your first visit, you want to gather information again from your health record or your primary care, uh, on what you should be doing with the specialist, and the kinds of things that they're interested in, or the primary care, even if you have a new one. Family history, vaccine types, when did you have them late? What medications do you take? What over the counter kinds of medications do you take? If you have symptoms that you're going for, you can research them online. I always recommend going to reputable sites. Certainly, AI is not necessarily the best way to get health information, but going to reputable websites for reputable centers, like the Mayo Clinic, for instance. Um, you're going to get good information, or from the different disease agencies. There's usually a specialty agency for, almost any diagnosis, and they have a great deal of information. And so that can give you something to start with, and then questions relating to what you're getting from there. Um, yeah, questions about diagnosis, yes. That's something you certainly want to ask. And again, you see things outlined here for you on the slide. What kind of tests are you going to get? Are there different treatments? What are my options? Is one of them more effective than the other? What are the risks of these various choices? What are the side effects? Are there interactions with the medications that you might be taking? Even certain foods, for if you take high blood pressure medicine, for instance, you shouldn't eat grapefruit or drink grapefruit juice. That's just one example, and there are many others. And also you see here a second opinion. When is it important to get a second opinion? And I kind of skipped over the answer questions, honestly. I always like to tell people, you can only get help for what you share. And so when they ask questions about your alcohol use, do you vape? What are your sleep habits? Do you have activity? How often do you exercise? Answer them honestly, because there's no, they're not there to judge. They're there to help you. So don't be afraid to speak the truth. That's how they're going to come up with good plans for you. All right. And if you don't understand something that they're telling you, don't be afraid to ask for them to, what do you call it, explain it, and you can say, explain it like you're talking to a sixth grader. We all have vocabulary that we use within the various industries, work environments that we're in, and healthcare is no different. But if they're using words you don't understand, well, that's not very helpful. um, and I don't know if I said take notes, but definitely take notes. The research tells us that we remember about 50% of what went on in the appointment. We lose 50% by the time we get to the car. And by the next day, 75%. The other thing is that we hear what we want to hear, and we remember what we want to remember. So take notes so that you have the actual information. Um, and you know, that's all with your doctor, but taking charge of your health, it does go beyond that. So now, we're after the appointment here, like you see on the slide, and we're responsible for keeping track of our health afterwards as well. So you want to understand your course of treatment. When you leave the appointment, you should know what the next steps are. Do you need a follow-up appointment? Can they print out the key points or email them to you? It's really our responsibility to understand the information so that we can follow up like we're supposed to. Um, Again, with the medications, make sure that they know everything that you're taking, all the supplements, all the over the counters, any other things that you do in the way of treatments, more Eastern medicine? Do you go for acupuncture? Do you do Reiki? It's good for them to know all of those things. And you can ask about those things as well. Asking about side effects, how much medicine you should take, how often you should take it. Is it going to be on the bottle? Yes, but it's nice to know that when they're telling you, because maybe the nature of your work is such it's really hard for you to take pills in the middle of the day. So can they order it differently so that it's just morning and night, for instance? Is it better to take the one a days morning or night? What are the side effects? Do they help you sleep or do they keep you from sleeping? So you want to know all of that kind of thing. And your pharmacist is a good resource too. I mean, they're part of the team. So don't ever hesitate to ask your pharmacist these kinds of questions specific to medications for sure, because they are the experts there. And in terms of your tests, you want to keep track of the results. They send them to you if you have an online chart. Look at them. Are they different from the last time that you had these tests taken? Are they better? Are they worse? You'd be surprised. Sometimes you find things that have actually been overlooked, where there was something that happened in a previous report that somehow nobody told you. You didn't get that. It wasn't in the report at all. This could be an x-ray or a scan or something like that. And now that you've had it done again, currently 6 months, a year later, they're saying, as compared to previous tests, there is whatever, an infarct in a cardiac vein, or something noted on a brain scan, whatever it might be. You didn't hear about it the first time. Why? And it's there now. So you want to be able to address those things. So definitely, look at your results and look at the dialogue that goes along with them. And keep track of that, and jot stuff down so when you do talk to the doctor, you can ask questions, for that. And if you have the opportunity to have an online chart, definitely sign up for it, because it's a great way to really be in the know, and to partner with your providers. All right. And if you're having surgery, you want to be informed about that too. What's the prep? How long does it take? What's the kind of anesthesia? What can you expect afterwards? How long will you be missing work? All of those kinds of things are reasonable questions to be asking. Also, does the person who's doing it have experience with the procedure? Or did they just go to a conference this past 3 months and learned it there, but they haven't really performed it very often? And when you're discharged from the hospital or a surgery center or wherever that may be that you're having things done, ask what the treatment plan is going forward. And again, take notes. And if you need help at home as a result of what's ever been done, this is the time to set it up. You can get help for it while you're there versus it being totally on you once you get home. And if any problems occur, certainly you want to respond to that. Again, you see it right here on the slide. When in doubt, call the doctor. Don't think, well, this is probably normal or it's not. You don't know. So call them. All right. And then I want to spend a little time talking about costs. I'm watching the clock here. Um, you really want to be well informed about your insurance coverage. All right. There is another handout that's titled Healthcare Funds Table. And that again is going to speak to the alphabet soup of HRAs, HSAs, all of those kinds of things, that we're not talking about today, but will be helpful for you to keep as a reference going forward. All right. Um, if you're managing your out-of-pocket expenses, and this is something most of us want to do, because it can be prohibitive. So you want to know your insurance coverage. When if you're not sure about something, either go online or call the carrier. We all usually have a phone number on the back of our insurance cards. That's what those people are there for. If the insurance doesn't cover a particular treatment, that's again when you might want to call around and see what's the price different at various facilities. As I've talked about before, some plans have out of network benefits as well as in network for various reasons. And so you want to check your plan to know what the cost is going to be. What's the cost differences between these various places? Where medications are concerned, again, you can save money. Ask, to have them prescribe generic drugs as opposed to the originals, because the generics have the same active ingredients. They may be a different shape, a different color, but you're getting the same benefits, and generally at a lower cost. So you want to be conscious of that as well. Most insurance carriers have what they call a preferred drug list. And so looking at that, and that's usually available to you online. Those are things that are covered under your benefit plan, as you see on the slide here. And again, I mentioned this already, but utilizing telehealth, nurse lines, 1-800 Ask a Nurse, have a virtual appointment instead of an in-person appointment. All of those things are going to reduce your costs. And then other out-of-pocket expenses, talk to your doctor about your benefits plan. Your care decisions that you make, are going to be have an impact. And so you want to have a conversation with your doctor about that, because, there may just be things that they do routinely, but there aren't other choices. And so if one thing's not covered, they may be able to give you another alternative. So you kind of want to partner with your doctor, and, have them be using in-network labs and testing facilities, those kinds of things. Look at those things that come in the mail, your medical bills and the EOBs that I mentioned before. Take a look at those so that you are aware of what costs are and what's going to be your part in it. And do cost comparison. And I mentioned that before, freestanding places tend to be much less expensive than having something done at the hospital. And they're often available, and some of that is going to depend on where you live. But you have the right to do that, to ask the cost of procedures. You can get a billing code, and once you have the billing code, it's really easy to call around and give that to the various places to see what their costs will be. And, when a doctor makes a referral to a specialist, again, ask them if in fact this is in network, and what's their reason for the recommendation for seeing somebody else. Are there other options available? You want to get as much information about their recommendations as you can. And is the specialist in network? What's their charge? Is the treatment necessary? Or is this icing on the cake? All of those things. And again, as I said, having access to this information puts us at a great advantage, but it also gives us the burden of responsibility. And, I am a healthcare consumer just like you are. So I'm fully aware of that. And I think sometimes that message does not come across, but I think it's important to know that, because we do have the access and we do have the responsibility. And the more we understand about that, the better care we're going to be able to access the best programs that are available. And then, your general health for life. These are all the things that we always talk about, the choices that we make, managing the costs that are associated with them. So I want to just take a quick look at some of those things. We're in the middle of cold and flu season. They talk about it this year as being the trifecta. We've got the flu, we've got the super flu, which they count as one thing. Then we still have RSV, which is going around. There is still COVID present. So, you want to be aware of that. Um, consider the benefits of vaccines. That's a big controversy in today's world, both medically and politically. We're all entitled to our opinions, but make an informed choice. Um, you know, don't just make the choice based on who said it. Look into the to that. Um, because it is important. I mean, they're talking about changing the health pyramid again, the food pyramid. Is it better than the last one? Is it worse? What are the differences? Pushing more protein, but is protein all red meat? No, there are other ways to get protein. So, again, here's the burden of responsibility on us. And you want to be able to manage your symptoms. If you do have anything going on, cold, flu, if you have a cough, it might be just part of a cold, it might be bronchitis. You want to be able to know what to do so that it doesn't turn into pneumonia. And then what are the treatment options? What are the care options? We all know, stay hydrated, plenty of fluid. You do want to eat nutritious foods, certainly. Um, Understand, what are your options? And then have backup plans. We all have times when we get sick, and you want to really handle that appropriately, not just for yourself, but in general. If you're sick, stay home. Can you work from home so you're not losing a day, but you're also not in the office or in your, work surroundings, working with people where you're spreading your germs around? That's important too. Be considerate about who you are putting at risk, and having backup plans helps. We might have childcare, but do you have sick childcare? A lot of childcare places now won't take kids when they're sick, but there are places that do. So knowing that, or do you have a babysitter that can come in if your child is sick? If you're sick, is there somebody who can take your child to child care so that they're not home with you all day catching what you have? And all of this, it sounds like common sense, but when you're under duress, we don't always make the best choices. And having been prepared makes all the difference. You're not thinking about it when you're at your worst. Preventive health, again, those wellness visits, the annual wellness visit, what we used to call a physical, they are important. Um, and if your doctor says you should come every 6 months instead of annually, ask them why. What are they going to do? What are the things that are important? What do you have going on physically that needs to be followed on a more routine basis? Get your healthcare screenings, different screenings at different points in our lives. Um, if you're young and you're looking to start a family, your lifestyle is going to be different than after you finish your family, or for women going through menopause. Um, you know, the screenings that are designed for us at different ages are designed that way because those are the times in our life where they are more likely to occur. So again, you want to be aware of those things. Go to your wellness visit, get your screenings, um, your general checkup, as I said before, and then diagnostic things. What should you have? What tests are you due for? Is it a mammogram? Should you have prostate exam? All of those things are important, and keeping up to date on vaccinations. If you're traveling outside of the country, you want to be concerned about what's going on. Are there other vaccinations that you should have, or medications that you should be taking with you in the event that you're going, that there is a problem? And then just, you can talk with your provider, as well as being self-responsible for lifestyle. you know uh you want to have a healthy exercise. You want to keep moving. And that doesn't mean that you have to like have, rigorous sweating exercise. I'm talking to people out in Chicago. So like it's 9 degrees real feel where I am today. It's cold where you are. I'm not exactly going to be out and running, or even going for a long walk. But what can you do? What are the things that you can do to have adequate movement every day, getting decent sleep? And if you know you have bad sleep habits, okay, look at that. And you're not going to change them overnight. Change your bedtime by 10 minutes. Change the amount of sleep that you get by adding 10 minutes or fewer if you're sleeping too much. All right. And nutritious diet. We see the gentleman here cooking. Um, so all of those kinds of things. And, clearly everything I've talked about is what's going on in healthcare. It's moving all the time. We are changing, as I said, various times in our lives. Our lifestyles change. The industry has changed and will continue to change. And the choices that are available to us change as well. Some are removed, new ones are replaced. And it really is our responsibility to stay on top of those things. All right, I'm going to stop there because we're really close to the end here. I want to put up your EAP benefits. Um, Please know that you have an employee assistance program. You have a very generous benefit. You have 1 to 6 face-to-face or telephonic counseling sessions per person per issue. You see, the first thing is household benefit. This is not just a family benefit. Household means anybody that you live with, as well as a kid. If you have children and you share custody, they're not only with you part-time, they are covered. You have kids who are away at college, their household is still yours. They are covered. So when you use these benefits, don't think that they've been used up. You used 4 of your 1 to 6 benefits. Well, so now you're thinking, oh, we only have 2 left, and I'd really like for my son to go. No, it's 1 to 6 per person per issue. So in essence, it's a somewhat infinite um, benefit. So, be aware of that. And you can do virtual again for counseling. Face to face is available, certainly. But, time is important to people, and it's more efficient if you want to do virtual. You can go online and look at these benefits. In addition to those face to face programs, appointments, you have unlimited telephonic support. So you can call the EAP anytime, 24/7, about anything that's on your mind. Don't hesitate. And the access number for you is 888-371-1125. All right. And if you want to look at the benefits online, you just go to mysigna.com and you just sign up once like we do for anything else we're doing online. And your ID is always your employer. And for you, it's really simple. Your ID is CTA. All right. Um, in addition to the counseling services, they'll help you with really pretty much anything that, all of the stresses and struggles that we face in life, elder care, child care, legal services. You get a free initial consultation and a discount if you decide to engage with someone who is in the network, whether that's has to do with housing, or it has to do with wills, that kind of thing. And the same is true for financial, a free initial consultation and a 25% discount if you choose to move forward with them. It's tax season. Both legal and financial services do give you a 25% discount on tax preparation. So that's all of that. And you're going to get handouts. I'm going to put the slideshow down. And I guess I can stop sharing at that point as well. So, okay, I'm coming back to y'all. Are there any questions that
Yeah,
came
thanks.
in?
Thank you, Karen. That presentation was great. I know that like as we get into the new year, it's really important that we kind of pay attention to all these nuances when it comes to healthcare. So just kind of put it back on everybody. You know, I'm going to go ahead and monitor the chat. So please feel free to put your questions in there. And Karen will do her best to answer them. If you have any other questions for us, you know, you can reach out to the wellness team directly as well. But I'll just go ahead and unmute myself now and stop talking so people can go ahead and put their questions in the chat.
Okay. Meantime, I'll say thank you all for your time and attention. I really appreciate your being here. And don't hesitate to call the EAP either if you'd like more information about something that I said, but you would like it explained at more length. You know, feel free to do that as well. All right, I'm looking at chat. Do we have chat coming in? I don't know if yeah, mine's not popping up. So I'll let you tell me if there's anybody in chat.
No questions yet, but Kathy did say thank you for the information and for your time today.
You are most welcome. It is my pleasure. I hope I'll have the opportunity to work with you all again through the year.
Jennifer again says thank you.
I appreciate the team helping too, you know. Thank you for giving me access to being able to share and move the slides and
Yeah, of course.
looking at the chat, all of the things that you do to make these things work.
Yeah, of course, we're happy to help. You know, the wellness team is always very grateful when, you know, you guys can provide some more information on the EAP benefits. Just a lot of thank yous and gratitude in the chat. Looks like, Karen, we don't have any questions. So I think that we can go ahead and we can say goodbye to everybody. And once again, on behalf of the wellness team, Karen, thank you so much for providing this information. And thank you everybody for joining us today. And as I said before, if you have any questions, you know, please feel free to reach out to the wellness team, wellness@transitchicago.com. And thank you all once again. Oh, here we go. Juan, where do we get the handouts? Juan, we can go ahead and email those to you later today once we get the recording of the seminar over to you as well.
And I urge you, do take a look at them because it really helps to kind of support the things we talked about, give you maybe a little bit broader information. There's only so much we can fit in an hour. So I do urge people to take a look at those. And again, thanks and have a wonderful day. Stay warm and stay well. And I hope I'll see you again in the future.
Excellent. Thank you so much, everybody, and be on the lookout for that recording and those handouts.
Thank you.
Take good care now.